This is most often a highly curable disease. Most men will beat it. And I think that's the sort of the silver lining in the situation. A lot of times our focus is on how do we treat this? What treatments do we need to get? How do we get like a cure for these patients? How do we get control of the cancer? And less on the side effects. But for testicular cancer, because our men live so long afterwards, it's becoming, it's getting better recognized and is getting a lot more attention from the medical field. We have a playbook that we can follow, and if we follow that playbook, then we really can optimize outcomes for them. And so it involves a series of clinic follow-ups, blood tests for tumor markers, and scans. At UNC, we've been really spearheading some patient-engaged research. So working with patient advocates, survivors of testicular cancer, understanding their experience and really pursuing research that they find is important to them. And so that that started off with a small pilot project that we did with a couple of sort of inspired by a couple of very well-respected testicular cancer survivors in the community. In order to do that, we did a bunch of interviews with testicular cancer survivors to understand what are the pain points for them in their experience, and really sort of use that as a guiding light to pursue. Don't hesitate to seek out attention. I think that's like the biggest things. I think sometimes it's a kind of in a taboo area. It's like it's a very private area of people's bodies. I think a lot of times, people who come and present with more advanced disease, it's not that they didn't know something was wrong, they just were kind of embarrassed to get attention and get help. And so, I would encourage people, if they feel like there's something that just doesn't seem quite right, that they, seek out, some medical attention. And if it is something, more than likely we're going to be able to treat it for you, and you're going to be able to go on and live your life afterwards.